lifestyle medicine is the use of lifestyle interventions directed at the treatment, management, and prevention of disease.
Hey folks, Dr. Keel here, and I want to take a few minutes to talk to you about the health benefits of folic acid, aka vitamin B9. Like all B vitamins, folate plays a role in the metabolism of carbohydrates, fats, and proteins. More specifically, it plays a direct role in nerve and brain function. It aids in the production of genetic material, specifically DNA and RNA, and is critical during periods of rapid growth and cell turnover, such as pregnancy, infancy, and childhood. Folic acid is also a cofactor for red blood cell production and helps moderate homocysteine levels. Its most well-known benefit is the prevention of birth defects, and that's why it's supplemented. All pregnant women should be on prenatal vitamins, which includes a hefty dose of folic acid. This significantly reduces the risk of birth defects, especially to the brain and the spinal cord. Heart disease, it may directly reduce your risk of coronary artery disease and heart attack, although the evidence is weak. And it does moderate homocysteine levels, which are known to increase your risk of heart attack and stroke. However, supplementing with B vitamins, including folate, has not yet been shown to reduce that risk. Similar to heart disease, elevated homocysteine levels have been shown to increase the risk of dementia, Alzheimer's disease, and a decline in cognitive function. Whether supplementing with folic acid actually reduces these risks is not well understood. It can help with age-related hearing loss, potentially with depression. Folks with low levels of folate are more likely to be depressed. However, studies using folate as a supplement to treat depression have produced mixed results. And individuals with low folate levels are associated with an increased risk of cancer of the colon, breast, cervical, pancreatic, and stomach cancer, as well as acute lymphocytic leukemia. It may have some other benefits as well, requiring more research. This includes amenorrhea, anemia, bipolar disorder, chronic fatigue syndrome, diabetes, Down syndrome, epilepsy, glaucoma, gout, high blood pressure, glucose intolerance, kidney disease, multiple sclerosis, phenytoin-induced gingival hyperplasia, prevention of pregnancy complications, blood clots, vitiligo, and Fragile X syndrome. The recommended daily allowance in most adults is 400 micrograms per day. In pregnant women, it's 600, and in breastfeeding women, it's 500 micrograms per day. Deficiency can lead to diarrhea, graying of hair, mouth ulcers, peptic ulcers, pore growth, and swollen tongue. Side effects are very rare. Obviously, supplementation is best done under the care of your doctor. Very high doses can cause stomach problems, sleep problems, skin disease, and seizures. There are a lot of drugs that either interact with folate levels or can lower your body's level of folate, so be sure to talk to your doctor if you have any questions about any possible drug-drug interactions. Natural sources include greens such as spinach, dark leafy greens, asparagus, turnips, beets, Brussels sprouts, lima beans, soybeans, kidney beans, white beans, beef liver, brewer's yeast, root vegetables, whole grains, wheat germ, bulgur wheat, salmon, orange juice, and other citrus, avocado, milk, and most grain and cereal products in the U.S. are fortified with folic acid. So in conclusion, folate plays a role in carb, fat, and protein metabolism, helps with DNA and RNA, nervous system development, and is critical during growth periods. Reasons to supplement include preventing birth defects during pregnancy, possibly heart disease, dementia, depression, and cancer. Many other potential benefits that do require more research. The recommended daily allowance is 400 micrograms per day in non-pregnant adults, and there are many good dietary sources including vegetables, beans, and grains.